Hi, my name is Shannon. I'm a level two McMaster nursing student. Can I get your name? Mr. Mancini. Okay. Can I also get your date of birth? Okay, I'm just going to verify that on your armband. Okay, Mr. Mancini, so today what I'm going to be doing is first I'm going to give you a subcutaneous injection of 5,000 units of heparin. This is given every 12 hours, and your last dose was given 12 hours ago. And then I'm going to give you an intramuscular injection of Haldol. It's going to be 1 milligram. It's given every 4 hours, and your last dose was 4 hours ago. Before administering the injections, I'm going to ensure that the 8 rights of medication administration are met. So these are right patient, right dose, right time, right route, right medication, right reason, right documentation, and right response. Also, before administering medication, I'm just going to assess the patient's body build. So the patient doesn't appear to be malnourished or abnormally thin. So I'm going to give the subcutaneous injection in the abdomen, and I'm going to give the intramuscular injection in the deltoid muscle. Mr. Mancini, before we begin, do you have any allergies that I should be made aware of? Codeine? Okay. Okay, so before I do my injection, I'm going to perform hand hygiene. Okay, so I'm doing my subcutaneous injection of heparin first. So I'm going to use my 1 milliliter syringe because I'm injecting 1 milliliter of heparin. And I'm using the 25 gauge needle because it's a shorter needle. So before I prepare it, let's prepare my vial. So I'm going to take an alcohol swab and swab the top of it. Okay. Now I'm going to take the cap off of my syringe. First I'm going to inject air into the vial to make sure there's no air bubbles. Okay, now I'm going to drop 1 milliliter of heparin. I'm going to put the cap back on and set it down. Perform hand hygiene again. And I'm going to put on the gloves. Before doing my injection, I'm just going to inspect my patient's skin. So upon inspection, I don't notice any lesions or masses. I noticed that the nurse before me did the injection on the right side, so I'm going to do it on the left side because there's no bruising here. For landmarking purposes, I'm going to do the injection 2 inches away from the navel, and I can pinch about 5 centimeters of the skin, so I'm going to put the needle in at a 90-degree angle. Before doing my injection, I'm just going to clean the patient's abdomen. Okay, so I'm just going to rub with an alcohol swab in a circular motion for about 20 to 25 seconds over the injection site. I'm going to take the cap off of my needle and then pinching the skin about 5 centimeters, I'm going to insert it at the 90-degree angle and inject. Now that the injection has been administered, I'm going to flip up the safety cap and I'm going to dispose of the needle in the proper disposal container. Okay, so before doing my intramuscular injection, I'm just going to label the vial used for Mr. Mancini's heparin injection. So I'm going to label it with the correct name of the patient, so Mr. Mancini, and the time, so that the nurse after me knows when it was given and knows when to give it next. Okay, so I'm just going to perform hand hygiene. Okay, so the needle that we're going to be using for the intramuscular injection is a 1 milliliter syringe because we're administering 0.5 milliliters of Haldol, and then we're using a 22 gauge needle because it's bigger for the intramuscular injection. Okay. So I'm going to open up my vial of Haldol and clean it off. Okay. I'm going to take the cap off of my needle. Again, I'm going to inject air in first to reduce the amount of air bubbles. Now I'm going to draw up 0.5 milliliters of the Haldol. Okay. And just get all the air bubbles out. I'm going to recap the needle and perform hand hygiene again. And now I'm going to put on gloves. Okay, so I'm going to do an inspection of the patient's deltoid muscle. So I don't notice any lesions or masses. I'm going to administer the injection 3 finger lengths from the acromion process. And we're doing the injection in the deltoid muscle because we're administering less than 2 milliliters of medication. So first, before doing my injection, I'm just going to clean the site. I'm going to clean it in a circular motion for about 20 to 25 seconds. The medication is just going to be administered at a 90-degree angle because it's intramuscular. I'm just going to insert it. I'm going to put the safety on the needle. I'm going to dispose of it in the correct container. So now that the needle has been disposed of, I'm just going to wipe off the patient. Okay. I'm going to dispose of my gloves. And once again, I'm going to put this label on a vial of Haldol, and it has the patient's name and the time that the medication was administered so that the nurse after me knows when it was given and when to give it next. So now that everything is completed, I would document the time that I gave both medications,